Medical emergency mid-flight. You are on a commercial airliner. You're traveling 2 hours, 6 hours, 14 hours. You're going somewhere on holiday and you hear that dreaded sound. Bing bong. Medical doctor, nurse, paramedic needed mid-flight. I'm going to tell you exactly what you need to do if you're in a flight and you need to respond to an emergency. The first thing you want to do is make sure you're actually in a state to respond. Now, some of us might be 2 or 3 or 4 wines in. You might be completely inebriated, might be extremely tired, and you know better than anyone else whether you can respond to something in a professional sense, in a medical sense, right? So if you can't, and if you know you can't, perhaps make yourself known, but tell them very clearly to say, yes, I'm drunk and I can't actually respond to this. There are a few countries in which if you do have medical ability, so if you are a doctor and you do not respond or you do not make yourself known, that could be held against you. Some countries like Germany. So this is an actual rule, so you need to be careful of this. And if you're that unlucky that you do get a medical emergency, someone dies, and you didn't put your hand up, that could be a bit of a situation. But hopefully that doesn't happen. The next thing you want to do is actually carry your medical ID with you. So when I travel, I always carry my medical ID with me to let everyone know that I am a doctor, because if I actually want to respond, they need to see my medical ID to verify the fact that I am a doctor. Last time I responded to a medical emergency mid-flight, can I see your medical ID, because I can't allow you to treat this patient without it. A way around that is that you can actually tell them your GMC number or your professional registration number, and they can use the airline Wi-Fi to actually search it. So you can get around that. The next thing you want to do is that you stood up, you're ready to see the patient, whoever's traveling, whoever's sick. Just calm yourself down. And remember, seeing a patient on the airplane is exactly the same as seeing a patient on the street, seeing a patient in the hospital. Just go through A, your B, your C, your D, and your E. Airways, breathing, circulation, disability, and exposure. Do a history, if you can do a history, if you can examine, and of course diagnose and then treat. So just treat it the same exact as you would in a hospital. Now, rest on what you've been taught on your medical career, on how you've been trained. Because if you're a medical professional, then you know exactly what you need to do. Now, one of the big things that medical professionals are scared about is, let's say they're a psychiatry doctor, or let's say they're a cardiology doctor and it's a gastrointestinal problem, or they're a psychiatry doctor and it's a cardiology problem. A lot of medical professionals are scared that they actually are not competent in whatever that thing is. But I reassure you right now that you responding to an emergency is better than nothing, and you being there to take advice from other people or to at least give some reassurance is better than nothing. The next thing, which is super important, is that once you've done your initial assessment and you examine the patient and you have an idea of what's going on, the next thing to do is actually make a phone call down to the ground medical services. So all the big airlines have subscription to ground medical services, which is a 24-hour round-the-clock medical service which is there to respond to emergencies. So they actually give you advice, medical advice, for you to act on. So how it would work is that, let's say someone has chest pain, you're doing your examination, you talk to the emergency medicine consultant on the ground, and you tell them, hey, this patient has got chest pain, it's going to the left side, we've done an ECG, these are the findings, this is how I want to treat, and they can say, yes, that's a good idea, or no, don't do that. And not just that, but they can help think about where you need to divert to. So often, if someone is in grave danger of being seriously incapacitated or dying, they can actually land the plane early. They can actually divert the plane to somewhere else in order to get that patient or that passenger some healthcare. So they can actually say, okay, you're gonna land in about 1 hour's time, half an hour's time, and there we can get some more help for you. There we have some tips and some tricks that you can use if you are a medical professional in a plane and they call for a medical emergency and they need help. Number 1, make sure you're mentally prepared. Number 2, calm yourself down, focus on what you need to do. Number 3, do your simple A, B, C, D, E. Number 4, make sure you have your medical ID. And number 5, use the ground medical services. And that's it. Since you stayed to the end, I'm going to give you an extra bonus tip. Often in airlines, big airlines, they have a medical kit which you can open, which has all different types of drugs and equipment that you can use for your patients. And often they may not even mention that this is around. So you might need to ask for them to open this. It's usually a metal container, a metal briefcase with anti-epileptics, propofol, pain medication, and sometimes they have some control drugs as well in there. So you can use those if you need to. So those are your tips for answering a medical emergency in flight. As always, stay fly.